What are some of the major strides made so far, by the agency in recent years?
Yes, one of the major strides is reducing the rate, prevalence. Some years back, we had a prevalence as high as 3.4. As we speak today, we have a prevalence of about 1.4%. So there has been a major, improvement in reducing the prevalence of HIV/AIDS, and we should also bear in mind that the prevalence of HIV/AIDS is more with the young people, the adolescents, the young the young adult, and therefore, because of course for obvious reason, their lifestyle, the risky sexual behaviors, and of course they're in the reproductive age group, and therefore we need to continue to pass out the message of prevention. Prevention is always better than cure, and is obviously cheaper than cure. So we want to use this medium to encourage our young people, and in fact the general population, of course, we have the ABC of prevention, which talks about abstinence, talks about being faithful to a partner, and talks about using condoms, when having sex. And of course, we have a D now that talks about, drugs. We notice that many of our young people now take illicit drug, and studies have shown that, of course, when you take drugs, sometimes you are not in you are inhibited, you are uninhibited, and then you are not in control of yourself, and of course, you can engage in so many risky sexual behaviors. Even some drugs that do not contain nicotine directly, shisha, shasha, and so many other, all this Colorado, Kunshi, and so many of those local, they are very dangerous to health, and of course, they aid HIV transmission, particularly when they have injection users.
Okay, before now, I know it's, like I mentioned earlier, it's a scary reality now. A lot of people don't want to hear the word HIV or AIDS. Now, is stigma still an issue?
Yes, unfortunately, it still is an issue, because we do have periodically what we refer to as the stigma index study, where we go around Nigeria asking questions, using our instruments, questionnaire, having some key population discussions, having some interviews with people, vulnerable people, and we realize that yes, stigma is still an issue, and it's quite detrimental, to the HIV national response. I say it's detrimental because when people are stigmatized against, they will not come out and declare the status. When they're stigmatized against, they will be afraid to be tested. When they're stigmatized against, even when they are tested and they test positively, they will not go to health centers to access care, because they are ashamed. They don't want to be stigmatized against. They don't want people to know their status. And by this, they'll be living with the virus, and the virus, will overwhelm them. Apart from that, they would easily transmit the virus to their spouses and other, caregivers and family members. But if we eliminate stigma and discrimination, then people that can come out, they can be tested, they can access their medications, they can access their drugs. The husband can remind the wife, have you taken your medications? The children can say, Mommy, remember to take your drugs. Even the children can go to school, boarding school or anywhere with their medications and take their medications without anybody looking at them anyhow, with any kind of reproach. And by doing this, the viral load will be so suppressed, and they will not be able to transmit the infection to somebody else. And that's what we refer to as U equals U. Undetectable equals untransmissible. So if you are using your medications regularly, the viral load is so low that even, in fact, if you take the HIV test at that time, it will come out negative, because there is no, it's as if there is no virus in your system, because the drugs have suppressed it. And that's why we all as Nigerians should not discriminate. We should not stigmatize. We should rather embrace them with empathy, and compassion, so that they're able to live positively with this virus. And in return, we are kind of protecting ourselves, because when they are safe, then we are safe.